This is Breaking MedTech. I'm Ryan. That's Cope. And today, we're talking PhD.
Yeah, everybody should get their PhD. How many times have you heard that? Well, never probably. But
Never me? Nobody's talking.
No one's ever heard that.
My name and PhDs don't go together.
Right, but everybody should get the PhD if they're in sales, marketing, or med device founders, but not the PhD you think.
No.
The PhD is a PhD in the problem you solve. Be a doctor in the problem you solve. And yes, PhD stands for something. Yeah. So you can't even keep a straight face.
Because I'm imagining some bro at a conference going like, you need to have a PhD in the problem that you solve.
That's why I'm the doctor of problems. PhD, baby. Problem, hassle, and dishappiness, distaste, discomfort, I made up one word in there. Dis being Latin for for being not, I don't like it. All right, like that's what it is. So you want to have a PhD, baby. This is what drives me crazy. Everybody's got a PhD in their product or service.
Okay.
And I'm sorry, that's cool. That's table stakes. Now you got to go get a doctorate in something else. And you probably already have it. That's the funny part. So is there anything you want to add before I jump into this?
No,
we're going to use an example of one I heard this week that I might have been considered a bit rude.
No, you go.
But it was invited.
You're on a roll.
Okay. It was invited. So what I mean by a PhD in the problem is, can you describe the problem that you solve? And I'll give you a couple of examples in such a way that you sound like the domain expert. Like if somebody wanted to write a book on that subject matter, I'll give you one right now that I'm dealing with. Is I'm selling a really, really, really well-made line of instruments. They have reusable, but these are disposable, and they're awesome. Like they're great products. And I don't even care about the sizes and stuff. People are like, do you have the Fetzer valve and the 10 French? And I'm like, probably. Let me look it up. Hang on, right? Because I don't need a PhD in the product line. What I need to know is, here's the problem that this thing solves. And right, here's what the problem sounds like. Ready? These suction devices get used in like all of these cases, so many cases. They're used, and you're sucking in stuff out of a surgical wound. Do I need to say much more about what that is? And depending on what kind of procedure you're doing, there's soft tissue, there's bone, right? And then the case is done, you sew that patient up, and those instruments go to sterile processing. And you used to basically just run them through a washing machine and run them out. Well, here's what they're finding. They're finding these tubes that you're using for suction have long holes in them, lumen, right, as they're called. They're almost impossible to clean. Nobody could look inside of them, and now people can. And when you look inside of them, you're finding stuff in there from previous people you used that suction on. So what do good places do? Well, they're like, well, hold on. We got to inspect all of these. I've got to buy a $3,000, $5,000, $8 borescope and stick this little camera down through and make sure it's clear. Well, what do we do if it's not? Well, we got to replace it, right? At the same time, sterile processing is short-staffed, and you've asked them now to slow down more and use more inspections. So they're not doing it in some cases. And now the Joint Commission is saying, hey, you got to document it, or you're at risk for a finding/citation. So sterile processing is losing their mind, or is waiting for their instruments. So what do the hospitals have to do? Well, I guess if we slow down, we got to buy more instruments. So their costs are going up at a time when they're all complaining about their 2% margin that they're operating on. And it's slowing down the OR. So ORs are less profitable, more frustrating. All for a stupid little straw, right? That you're going to spend $40 for a reusable straw and use it a bunch of times. But then you're going to spend hundreds and thousands of dollars to reprocess it. And it's impossible to reprocess. And you have to inspect it. And now you have to document it. And now you're at risk for citation. And it's an infection risk. And it's driving surgeons crazy. Or you can buy mine, disposable, and never have to worry about it again. And I think it probably comes in 10 French. Let me look. Right? I know this story because I know it better than anybody. Because I've talked to everybody in those positions, and that's what customers have told me. You're going to spend $60,000 this year on your ENT procedures, just reprocessing these things with a high risk and a lot of errors. Or you can spend $20,000 on mine and go worry about something else. And, right, like, that may not be compelling enough, but it's compelling because I sound like I know what I'm talking about. And then that nurse who runs the OR, who doesn't believe me because I'm a salesperson, she's like, huh. And then she goes and talks to sterile processing. They're like, yeah, it's impossible. We can't do it. We're supposed to be putting a borescope down. We're not documenting, like, when they're honest. And surgeons are like, yeah, it's driving us crazy. Like, I don't know. I can't have this. And nurses are going, we got to check it before we put it down. I've got a PhD in the problem. I've just described it. No, I don't think there's anybody on the planet that knows this better than I do, because I want to get my PhD in the problem, right? So I know what the problem is. I know how much hassle it is. I know how dissatisfied they are. Okay. All these things. Does that make sense?
Yes.
So that's a problem.
So that's a problem. And I would point out to the audience, I'm going to guess that when you pitch this to someone, it's not as long. It's probably very tailored to what their specific pain points are.
Exactly what they're dealing with, yeah. I'm making this up as I go along because I'm learning how to present it effectively. And I just did this from the seat of my pants.
A seat of his pants. I can vouch for all the listeners. Seat of his pants. But no, you're spot on, right? And the funny thing is again, we talk about emotion all the time. Like, everything that you said is like poking at someone's emotions, where they're listening to you and you're describing, like, if you're sitting in front of a sterile processing director and you're like, listen, you had to go buy a borescope that came out of your budget, and now your staff is complaining that they can't do it. You're on their ass because the OR is complaining to you. It's like the chain of yelling. OR yells at you, you yell at staff yells at you, quits, now you're all over, all right? And you're describing this whole thing, and that person's sitting there, and what they're doing is they're slowly digging their fingernails into their leg, and they're like, oh my God. And you never once said, here's my product. No. Never once, right? Now, that doesn't mean, like, what you're going to do then is the second, and then, like, you're just going to take your thing out of your bag and you're going to put it on the table and you go, here's your solution.
Yeah. And then they're going to go, wow, this is really nice. And I'm like, yeah, that's disposable. They're going to be like, this is how it goes, right? Now, do we win all of these? No. Like, we're starting to get some wins. We just started. But what I wanted to know was, what's the problem look like, sound like, smell like, feel like? What trouble do you get in if you don't solve it? What's the scary part? And then who are the audience members I need to talk to so that I can tailor it to them? So, like, I can tell a sterile processing director, listen, I talked to somebody else who does exactly what you do in another place, and she said, if we hit the borescope, everything that has lumen in it, and that's shavers, and that's spine stuff, and that's endoscopes, if we have to do this for everything, we're never going to get anything done, right? And I'm like, oh, you're probably right. I can't help you with some of that stuff, but this will eliminate that, so maybe you can do some of those things. And if you don't, and I'm saying to the director of perioperative services, look, they're going to do their best, but now they not only have to do it, you have new people coming, you got to make sure they know what they're doing. They have to document it, and then you have to log that, because the Joint Commission is now coming in and asking you, well, yeah, I'm sure they did it. Yeah, cool. Just show me your documentation that they did it. Now you have a quality issue. Now you have a regulatory problem. And that's my discussion to them, to the surgeons and the OR nurses. They're like, oh yeah, they're like all complaining. I can go deep on each audience because I've talked to them. I quote them. I've told people, is it okay if I quote you? These other places I go, and they're like, yeah. I'm like, thanks.
I'm going to tell a story of, like, when I was a younger rep. I'm going to be very honest. I sucked at this, right?
We all did, by the way.
It's like a therapy couch. I sucked at this. And what I what I will tell you is like, I look back at it and go like, hey, you should have spent more time figuring out this than listening to product managers, no offense, product managers, who were just like, oh, talk about this feature, talk about this thing, talk about this, right? And the best one I've ever seen is like in person of it being like I felt awkward being there was I remember being at a trauma conference once with this is an example of a product manager who did not understand the problem. I remember being at a trauma conference once, and I was with a trauma surgeon, and we were walking around, and we walked over to this booth, and there was it was this K-wire thing. It was like disposable break-off K-wires, okay? And the idea behind it was if you're putting in a lot of K-wires, if you've ever seen anyone put in trauma K-wires, they do a lot of pulling in, pulling out, pulling in, pulling out, trying to find the right one. And the idea behind this K-wire was you could put it in, and if it didn't work, you could actually snap it off, and it would create the bone would grow into it. So you're not just making a mess with K-wires. And the surgeon who was there was like, literally looked at him and goes, hey, we have a problem with K-wires. That's not the problem. That's not the solution, right? Like, that's not our problem with K-wires. Our problem with K-wires is it's hard to place K-wires. He's like, we're not trying to mess up every single time. You show me a way to put in a better K-wire, then I'll do that. Don't show me a way to, when I do a K-wire, snap it off,
fix my air balls,
and then I have to, and then the hospital's yelling at me because my K-wire cost went from $5 a case to $55 a case because I'm. And it was, and like he was being very nice about it, but it was like a perfect example of this is a multi-billion-dollar company developed a product line and did not understand what the problem was. Yeah. They thought they were, they thought they knew what the problem was. They didn't understand the problem.
Yeah. Yeah. And that is a very good example. I actually talked to a perioperative services director about this suction, and she didn't really know there was a problem. So I was talking about the problem, right? And I was saying to her, I'm like, listen, there's a bunch of different ways companies are trying to figure this out, right? Like I said, borescopes are becoming really easy to use and lower in price. So inspection is easier if you choose to tackle it that way. I said there's a really cool company that's created something that you can test those cannulations on the clean side of sterile processing without contaminating all of the clean side. And I said then there's companies that are coming up with single patient use, like the one I'm talking about. I'm like, I'm not married to any of them, but understand there's a problem, and here's how you know there's a problem. We've talked to your staff, and there's a bunch of companies trying to tackle this a bunch of different ways, right? And I said, I don't know which one's right, and I certainly don't know which one's right for you, but I do know if I leave here, I want you thinking, that's a problem. Because that guy sounds like he knows what he's talking about, and he told me he was quoting my people, right? So I would say, like, I'm a PhD in this. I'm actually a PhD, not just because my product might solve it. I'm a PhD in all the possible solutions and saying, like, hey, you should choose one of these, but you're going to have to do something. Mm-hmm. And then I'm seen as valuable because I come in and talk about things they were unaware of but are at jeopardy or risk or struggling with, right? So that's how I think you have a PhD. I'll give you an example of a company I talked to this week, Ryan, that had such a clinical problem that I believe that they solved. Okay. They don't pay me. Mm-hmm. I don't even remember the name of the company.
I don't know the name of the company, but I know they should pay you.
Well, that's not. Thank you. Here's the current problem.
Okay.
And I'll use very low-tech terms. Kids get what are known as bone cysts, right? And bone cysts are scary because a lot of times they can be cancer, right? Bone cancer. And but there's also a subset of these cysts that are, thank goodness, they're tumors, but they're benign, and they're made up of soft tissue. There's something funky in the bone that's growing, like they're oftentimes round, like you can see them on X-ray, right? And they look like they're soft tissue, or to be honest with you, I don't exactly know what they're filled with because the guys have been telling me about this. And right now, that kid, God forbid, that gets, because they usually have pain, let's say in their femur, like their leg, right? And they take X-rays and they're like, we see cysts, and everybody's on red alert. And now they're like, oh, good news, came back, it's not cancer, but you do have a cyst, right? You're following me so far, right?
Yeah. I felt that, by the way, the fear of like hearing that you should, yeah.
It's horrifying, right?
Yeah.
So here's the good news. It's not cancer.
Okay.
But the bad news is we have to do something about it because if you think of it, that bone is it's load bearing. You're putting stresses on it. You're growing. You're much higher likelihood to have a sort of a really bad fracture at that site, right? Because the bone is not created equal in that spot. So what they do now currently is they say, okay, you're 14-year-old male. You can't play any sports. You can't skateboard. You can't do anything. And what we're going to do is we're going to take you to the OR. We're going to make an incision. No incision is insignificant to the person whose incision it is, right? But we're going to make an incision. We're going to scoop out that cyst. And we're going to jam a bunch of stuff in there to help, sort of like spackling, to help grow bone back, right? Like, I want this. I told this company, you should be able to present this so that your spouse or your friends who know nothing about the business can understand it, right? I think everybody's following me. You're going to stay in the hospital at least a night, maybe two, right? And then you're not allowed to do anything until we know it heals. But really, we're going to restrict you. You may not play high school sports again. You may not skateboard or run or wrestle or do whatever it is you want to do. Right? Which sucks. It's awful. It's awful, right? Here's the worst part of the problem. 50% of those kids come back with another cyst within a year. Nobody's really sure why. So you can scoop one out and another one grows same spot or different area, right? So they got to go through the whole thing again, right? So you're not allowed to do things. You got to go have surgery. Surgery sucks. You got to stay in the hospital. You're scared. Your parents are nervous. Everybody's nervous. Thank God it's not cancer, but it still kind of sucks, right? Yeah. And this is kids. So here's the alternative that this doctor came up with. It's basically done in the interventional radiology suite, which is through a needle. Now, look, if I put the needle in front of you, it's a big-ass needle. Right?
It's going to hurt.
Yeah, but they can sedate you in the interventional suite. They can do it minimally invasively. They can stick what would be considered to be a straw, almost like one might stir one's drinks with, right? They'll stick that in under fluoroscopy, pull the cyst out, and inject a really cool bone substitute that goes back in there, right? And so part of it is the procedures. Go home the same day. As soon as you heal, you're able to go back to doing what you do. And there's not a big incision. It's not as scary. You go home the same day. There's no hospital stay. And for some reason, and I don't think they even know why, 86% of those kids never come back with another cyst. They don't really know why. Or maybe they do and they told me and I don't remember, right? Their marketing pitch was, hey, these things happen a lot. They suck for kids, families. It's terrible. Like, it was like almost in 1-point font. Here's our really cool bone substitute, blah, 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 blah. It looked like a sticker on the side of your car that you're going to buy at a used car lot. How many miles and tires. And I'm like, and Ryan, I got a little rude, but they told me, they're like, bring it to us. Both barrels, open them up. And I didn't open both barrels. I only opened up one. But they had such a problem that when you hear what I just talked about for 3 minutes, like, don't you feel like people should know about this?
Yeah, I I imagine
You're just hearing this the first time.
he is not. I just heard this. Like, that breaks my heart. Like, I want to cry. Now I'm a crier, but like, I want to cry. If I found out, like, thinking about like having to tell my daughter or my son, going like, hey, you can't play sports anymore, or you can't run anymore, or you can't be active anymore. Like, that would be like, that's heartbreaking, and I can't imagine what it would be like to be the kid, because I'm just such an amazing athlete. I only know being amazing. It's a joke. I'm not that great of an athlete.
Yeah, you're a 14-year-old. Yeah, it's not like you worry about what your peers think of you.
Yeah, no, not at all.
It's the engine that drives you all day long, right?
It's not like the only reason Little Cope had friends was because of a skyhook. So, God, I'm gonna get so many friends with this skyhook. So, yeah, you would think. And you know what's funny about, like, I would be curious to ask this company, like, why didn't you do it? And maybe is like, for all of the companies who say, like, oh, well, we can't do that because of the FDA, or we can't do that because, like, you can, again, you can't claim stuff that isn't factual, okay? So you can't claim, like, you can't go like, oh, but if you could, your product, but you can talk about the problem as much as you want, as long as, and it's like, and where you kind of cross a line is like when you, like, again, when you make up lies about it, where you're like, 75% of those kids who develop cysts end up developing alcoholism and live a horrible life. Like, yeah, no, that's a horrible thing to say. But, like, you don't have to do that. You can talk about the problem. Like, you would be so much more impactful having your CEO or your sales. Like, I'm just thinking, like, how would I do this? On your second part of your website, like your hero section is like whatever, I'd have to think of what it would be. But your second part being like a 45-second tight clip of your founder going.
It's exactly what I suggested to him. It's so funny. Yeah.
And again, he did not tell me this. This guy, actually, I don't like that. I don't like that one bit. You don't need me anymore then. So, but like, I would be like, get 1 minute clip, perfectly crafted story of going, here's what happened. Here's why. We don't know why it happens. Here's what it looks like for the kid. You don't have to go full on Sarah McLachlan dog. It's like sitting there in a cage. Okay. But you want to play in those emotions, because I know a lot of people think that, like, doctors are a-holes. Okay. That's not, like, they literally, that their entire life is about helping people. If you are a medical practitioner, your entire life is about helping people. Unless you're a plastic surgeon, and even they want to help people. Okay? Except for the guys from Nip Tuck. So, everybody wants to help somebody. Okay? That is so you're playing on their emotion, and you're going like, you see this conversation sucks for you. I have a solution for you. Yep. And they're not. Go ahead. Then you can introduce your product. Then you can introduce your solution and go, and here's how we solve it. And then the section right below that would be all of the awesome data-backed facts that you have about your product, which are way more impactful because you just explained how you're going to fix it, or what problem you're fixing.
Yeah. Well, and I think in their defense, here's what they are thinking. And Ryan, you know my consulting business. This is what I hear every single day. I can't get my product approved. And that's what these guys. So they're like, well, we need to give the people who approve it information about my product. And I would say yes. However, the first part is they need to know why anybody should even care about it. And that's the problem you solve. And they addressed it. I mean, I'm telling you, if you saw an 8.5 by 11 piece of paper, less than an inch was the problem I described. And 14 inches, we went legal pad prank, was about the viscosity of the the gauge of the needle. Nobody cares about that yet. They got to care about why, right? And I was saying to them, there are human beings on the other end of this, reading this, who don't know any of this stuff. Once they do, if you can't get this thing approved, I want you to tell me where they won't approve it, and I'm driving there.
Well, and
I mean, like, this is for kids.
And there's, this is for kids. What are you, horrible human beings?
Well, I mean, like that's what I might threaten some people. I'm this passionate about it.
He's a big deal. I often joke about how large you are. It is scary, okay? He shows up at your door.
Hey.
Listen, you know, I'm
you know this. I fight like hoopsters. You chest up and you square, and you hope somebody comes in between you. You don't have to, you maybe throw a slap at somebody.
I don't know. I saw that Ron Artest melee. So we I would tell you, even when you do the features, when you do the features, or when you like, hey, viscosity, or like, hey, this is done, like you always have to have the problem that it solves. So like if you're going to make a marketing piece or make something or write an email or do everything, like that's like when you see sales emails that suck because they write everything in it. Like if you're writing a 3 or 5 cold email sequence to it, each one of them should address a specific problem. It'd be like, did you know that these cases, when they're done in a hospital, cost this amount of money and you get this amount of reimbursement? And when you do it under fluoroscope, did I get that right? Or interventional radiology?
Yeah, it's not. No, it's fluoroscopy. They're doing it. They're doing it under fluoroscopy.
Okay. When you're doing this in the interventional radiology suite, and you get paid, it costs you this amount of money, and you get paid this amount of stuff. Like that's here's the problem with this one. Here's the solution with this one. Hey, when 50% of these patients come back, it didn't work, and they have another one. This one, it doesn't do this.
Yep. Yeah. Well, it's exactly, and you keep it. You don't. If you keep it simple, but they remember the problem. You know, like you think about the marketing piece I would write for them, which is not necessarily my domain. That's more yours. But I would say, like, I'd say to them, 4 parts problem, 1 part solution. Like I'm making a mixed drink, which sounds pretty good right about now. Is after talking about these kids is all problem, and then here, like, hey, it's done in the interventional suite. They go home the same day. Way big benefit, right? Small needle, way less invasive, less post-operative pain, whatever you're allowed to say, right? And way less scary. Something like, and then if people are like, holy smokes, we got to look at this. Then you have a technical page that says, well, what is this stuff we're squirting into these kids? Like, what do we get reimbursed in the OR, and what do we get reimbursed? I mean, I would say, like, I don't really care what they get. You put it there to make those questions get answered more easily, right?
I would say everything that we're talking about, because that piece is a top of funnel piece, okay? Ooh. That piece is a hook piece, okay? And with hook pieces, you need to hook people, all right? And
we went from sky hook to hook pieces. I like this.
Boom. Hook pieces. So when you're hooking, like the point is to hook. And I could tell you, I don't care if it's the biggest nerd on planet Earth. I don't know anything about viscosity. I just know it's a word. But like, if they were like, oh, this is whatever level of viscosity, and that was like the big text on it, like a billboard, no one's going to go like, what?
I've been searching for a high, or is it low? Because nobody remembers the high. Yeah. Which one's high viscosity means it flows fast, or is it low?
Nobody
viscosity?
Cares. Yeah,
nobody remembers.
Nobody cares. Yeah. Nobody cares. Nobody cares. Not a single part. Like, that's not what that piece is. And you then can talk about the technical stuff. You then can talk about all of the, like, with products like that. Then you can talk about all the technical things. Then you can, and I would tell you it's like a, this is where really being a pro in the problem, and really then, like, all of you people who memorize spec sheets, this is your day, because they're going to start peppering you with questions, and all those things you practice in front of the mirror while your roommate made fun of you is going to pay off, because they're going to go, hey, what's the viscosity like? And you're like, Dr. Smith, are you sitting down right now? You better be sitting down because
it's about to get syrupy in here, Doc.
It's about to
We're
get,
about
yeah.
to get viscous.
Then you get to talk about all the features. Then you get to talk about all the stuff that they do care about. It's just not going to hook them.
Well, if you think about it, like you described it well, you hook them with the problem. That's why you want to be a PhD in the problem, right? And then that stupid sales sheet that marketing people give you that have like nerdy viscosity, sizes, barometer, all that barometric pressure, all that crap. That's used to answer questions from somebody who's interested and needs more information. But if you just give them answers to questions they're not even asking, they're not looking for more information. They're like, well, when you talk about that problem, you now get their attention.
That's honestly, and I'm gonna clip this because I have that power. What you just said is a really important thing, and I actually hate marketing slicks, as my dad likes to call them. Like, I hate them because I don't think they ever do anything the way that they're currently constructed, right? I think and feel and know that you're way better off hooking someone the way that you hook them, and then that data sheet, that thing, it still should talk about the problem, but that's where you have that's where that thing is important, is that when you leave and you hook them and they're interested and they care about what you care about and they care about the problem that you're solving, you leave them that thing, and then it has all of the information that they may have after they know what problem that you solve. But if you...
Exactly.
It's like this, I think it's... I know you're going to tell me I'm wrong, but like the idea that like you're just going to show up at a periop director's desk, drop off a business card and a brochure, it's the biggest waste of paper. It's the biggest waste of paper on planet Earth. I have a very good friend who is like, she's my age. She's way more successful than I am. And she's like the VP. She's a service line president. You know her. You've asked me about her for a major health network. And I asked her once, and she's come up through the ranks. And I always ask her, like, do you ever keep any of that stuff? And she's like, no, not. Literally, it goes on my desk. And then once a quarter or once a month, when I'm really frustrated and I want to do stuff, I just throw everything off my desk. I maybe look at it for a second. And I'm sure someone's going to argue with me and go like, no, it works for me. That's great. It's the biggest waste of paper, right? You got to figure out a different way. Emails might even be better. Just be honest.
Think about it. Think about it buying a car. We'll finish it with this, right? You don't look at a spec sheet on the side of a window of a car or on a website or whatever until you know you need to buy a car or want to buy a car. And now you're answering questions. You're getting questions you have answered. None of that makes you go, well, I should buy a car. Like, that's not what drives your want. So if you're relying on a spec sheet to sell, you're using something designed to do something else for the wrong purpose. It doesn't. Yeah. So PhD, so let's button it up. We want to have a PhD in a problem because the problem is memorable and it sticks in their brain, and then you can go to your spec sheet. Then you can go to because that's what matters. You have to know it as well as you know your product, and I would argue you need to know it way better than you know your product. If you could only prioritize one, in my head, and no one will ever convince me of anything different than this, is you have to know the problem better than you know your product. It's more important. You will sell more. You will market better. You will build better products. You will, if you do that. If you do not, you will struggle.
I agree. The end.
There endeth the lesson.
Wow. You did take Shakespeare in college.
Well, I think I stole that from a movie in the 80s. So the Untouchables, here endeth the lesson, Sean Connery says. So here endeth our lesson this week. I feel a little bit better. I need a drink now. This has been Breaking MedTech.
Bye-bye.
See ya.